Hello friends, welcome to my channel Medical Knowledge. Here we are going to talk about some important medical things, related topics such as position, instrument, anatomy, physiology, related topics, and most importantly disease condition. You can share with me your problems, questions related to your study, doubts. I will try my best to solve it and help you. So let's start about today's topic. So friends, let's start about today's topic. It is position to the patient. It is the main important things a medical student should know, the different types of position. So the first one is supine position. It is the most common. It is the description is, you can see in the image, it is back lying position with arms on the side. In which situation it uses in physical examination, resting, undergoing anesthesia, and lung biopsy. We can use this position. Second one is dorsal recumbent position. You can see in the image how the lady is lying. It is also a back lying position. In this position the patient's head and shoulder may be elevated on a small pillow. Arms are resting on side. You can see in the image, legs are apart with knees flexed and foot resting on the bed. So in which situation it uses? It uses in physical examination of abdominal and genital area, in perineal care, in PV examination. PV examination means pervaginal examination, which is used in gynecologies. Trendelenburg, the third position is Trendelenburg. In the description, you can see in the image, the patient is lying on the back with arms on the side. In this position, bed is positioned in such a way that head of the bed is lower than foot of the patient, and there is no flexion at the waist level. Uses are shock patient, hypotensive patients, cord prolapse patient, to shift abdominal organ upward during certain surgeries, air embolism. The third position is reverse Trendelenburg. You can see in the image, you can see the difference between the previous image and this. It is just opposite to Trendelenburg position, and in this position head of the bed is elevated than the foot level with no flexion at waist level. Uses to minimize gastroesophageal reflex. So next, the fifth position is lateral. Patient is lying either on left or right side with hip and knees flexed, top leg in front of the bottom leg. In this position, pressure on the back and coccyx will be relieved and pressure is distributed along the scapula, lateral aspect of the ilium, and the greater trochanter of the femur. The uses are to promote lung and cardiac function, to relieve pressure on back and coccyx. After liver biopsy, right lateral position. Patient with pyloric stenosis after meals, right lateral, to promote entry of food into stomach and intestine, and during seizure attack and air embolism, left lateral. The sixth main position is Sims. Patient is lying on left side with semi-prone position. One arm is located behind the patient and other arm is flexed at shoulder and elbow. Both legs are flexed at the level of hip and knee, but the upper leg is more flexed and is drawn up to the level of chest. Uses are rectal examination, administering enema to prevent aspiration. The seventh main position is low Fowler's. In this position, head of the bed is elevated at 30° with flexion at the level of waist. The usage is to prevent aspiration during tube feeding, during increased intracranial pressure. The eighth main position is semi-Fowler's. In this position, the head of the bed is elevated to 45 degree with flexion at the level of waist. The usage is to promote lung expansion to relieve tension on surgical site following abdominal surgeries. Tracheoesophageal fistula, and next is paracentesis. So the ninth important position is high Fowler's. Head of the bed is elevated at 90 degree with flexion at the level of waist. Uses are to prevent the risk of choking, to relieve respiratory distress, nasogastric tube intubation, ARDS, asthma, COPD, emphysema, pleural effusion. Ortho-open position. The 10th position is ortho-open position. In this position, patient is sitting on or side of a bed with an overhead table to lean forward. Pillows will be provided to increase the comfort level of the client. Uses are to relieve respiratory distress. Second is thoracentesis, pericarditis patients, ARDS patients, asthma in case of COPD, and emphysema. The 11th important position is prone position. Patient is lying on the abdomen with head turned to one side to promote comfort. Pillow can be used under head and a small pillow or towel roll can be used under the abdomen. The uses are to prevent aspiration, recovery position after anesthesia, to relieve pressure on the back and coccyx, renal biopsy in case of neural tube defect, position after spinal surgery and hemorrhoidectomy. The 12th important position is lithotomy. Lying on the back with legs flexed at hip and knee, joint and legs are supported with leg rest and strap. The uses are childbirth, pelvic gynecological surgeries, transurethral resection of prostate. The 13th important position is knee chest position. In this, patient rests on the knees and chest with head is turned to one side, arms extended on the bed and elbows flexed on resting so that they partially bear the patient's weight. The abdomen remains unsupported, though a small pillow may be placed under the chest. In this position, severe hypotension occurs because of pooling of blood in the extremities. The uses are sigmoidoscopy and lumbar laminectomy. So friends, today's topic is finished. I hope you all are understood this topic. If you like my videos, please like it, share it with your friends, and for more videos like this, subscribe my channel. Thank you. Keep watching.